Today's first session is entitled Responding to the Mental Health Challenge in the Workplace. It will be presented by Sophie Ouellette, Vice President of Business Development at Sun Life Canada. Welcome to the virtual stage, Sophie. And I'm sorry, I just asked you how to say your name properly, and I totally bombed it.
No worries, no worries. Thank you, Martha. All right, so hello, everybody. Glad to be joining you from my home in Laval. So welcome to everybody from coast to coast. I'm really excited to be here with you today to talk about something that is very important subject, and a subject that is really top of mind for us at Sun Life. And I'm guessing that if you're taking the time out of your very busy schedules, I'm sure, to join us for that conversation, it is because it is top of mind for you as well. So thank you for taking the time to talk about the mental health challenges in the workplace. So today, what I want to do is first start by looking at what we're hearing from Canadians and how that is translating into what we're seeing in long-term disability claims. And we know that the pandemic is having an impact, so we'll touch on that as well. Second, I'd want us to look at the barriers, because we know that there are barriers, challenges for people to be accessing the resources that they need. So I want us to talk about that. And then finally, every time I see a challenge, I always say there's an opportunity to be found. So we'll, the last part of my presentation, we'll be looking at those solutions, the support that you can bring, and what you can do as organizations and managers to help your employees through the challenges that they might have. So first with the landscape and what we're hearing from Canadians. So we did a survey back in 2019, and what we find is that, 59% of Canadians say that they have had a mental health issue. And you can see that that's up from 52% in 2017. So it is something that is very concerning and continuing to grow. What is a bit concerning with that, what we found in the survey is that actually 61% of working Canadians aren't using the workplace benefits to manage, I guess, the issues that they're having. Another thing that we wanted to look at, because we've been seeing it in the data that we have, is actually, a spotlight on millennials. So we've had specific questions to them, and what we found is actually 2 out of 3 millennials have experienced a mental health issue. So that's very high. Very good thing, though, is that they're actually open to talking about it. You can see that 76% of them have actually spoken to a loved one or their family. And, they are receiving help. 39% of them have not, but, 61% of them are accessing help. Professional help, which is good. Maybe what is, a bit concerning, I guess, and we need to be careful with, is that actually they're not really accessing either the resources that they have in their workplace mental health benefits, or even, governmental programs, free therapy. So while they are talking about it, they might not be accessing all of the resources that they can have. If we dig a little bit deeper into that, so how does that translate into what we're seeing in the claims? So you can see that mental health, we've seen increase incidents in the past years, and we've seen that mental health, is increasing faster than any of the other diagnosis, and you can see it here. So mental health accounts for 30% of the claims incidents that we're seeing, and that's large, right? When you compare it to cancer, which is the second one, and it's at 15%. So you can see that mental health is continuing to grow, and it is a very important part of all of the claims that we're seeing. And if we continue to dig a bit more into that, the different types of mental health that we can, issues that we can see, you see that depression remains the number one. And really, when you look at the top 4, so depression, adjustment stress, anxiety and panic attack and bipolar, these account for 90%. So really, I guess with these 4 types, you can see that it's the vast majority of all of the claims that we're seeing in our block of business. I was talking to you about millennials, and why we wanted to dig a bit more into that is that we're seeing in our block of business that while mental health issues is not right now the number one reason for a claim, so the diagnosis, the growth of that is so important that there is cause for concern, and it might become at some point the number one for millennials. Here, what you can see is we've looked actually at the number of claims that we had in 2014 compared to 2019, and what was the growth of that specific to mental health. And you can see that for millennials, so below 35 years old, that growth is 50%. So as I said, we need to be very aware of that and make sure that we can come up with the right solutions to support them with that. As I was saying, so mental health, we've been talking about it. It's not new. We were seeing that and had done surveys in the past. But now, 2020, COVID hits, and you can see that it's really having a strain. We've been now several months into either confinement, restrictions. People can feel a lot of different type of stress, related to their health, family, financial. So we are really seeing that it's taking a toll on the mental health of Canadians. The vast majority of them are telling us that. We did a survey at the end of April, start of May. And what we found is that the vast majority are saying that COVID is having a negative impact on their mental health. But what's even more concerning is that 60% of them say that they're not receiving the treatment or social support that they would need. And you can ask yourself why. And we've asked them, what are the barriers? Why aren't they accessing the resources? So first one is affordability. Some people just, they find it too expensive or don't have the right support. Sometimes it's access. They don't know where to go. They don't know who to ask. And the third one is related to stigma. So while we've, I think, made a lot of progress as a society on that, it is clear that it's still, it's either embarrassment or people don't feel comfortable talking about that in particular. So what can we do? As employers, as people managers, we play a key role. We all play a key role, and it's more important than ever. Yes, there's additional stress that has come with a pandemic, and we need to make sure that we're all aware of that. It is real. It is concerning. We don't know, over a long period of time, the impact it might have on our employees and Canadians. We need to make sure that we can act on that. So maybe you're asking yourselves, what can I do? So, we've looked at, the state and a bit of the barriers, but what can we do to support them? So let's look at that now. So just, to come back on, what is important, I think the first important thing is actually we need to acknowledge the barriers and we need to understand them, because if we don't do that, it's difficult after to make sure that we bring the right solutions and the right resources to our employees in the workplace. So the barriers, I was talking about awareness of treatment. Yes, we have a public system, and, if you're here, there's also resources that employees have through their group benefit plans. But for employees, they don't really know all of those, how to access them. So, we need to make sure that, we remember that it is a barrier, and we need to make the information, available to the employees. Wait times as well is a barrier. Getting timely treatment can be a challenge, so we need to make sure that we're conscious of that. I was talking already about cost, and we saw that in our survey. So it is something, and on top of it, in a period like now where some people might have lost their jobs or been laid off, the financial burden can even be higher than it usually is. So it is an important barrier. And last but not least, as I said, stigma. I think we're doing great things in Canada to try to remove as much as we can that stigma. But it is a fact that it's still there, and we need to make sure that we can change that. And some of us might say, well, we've made so much headway on that, right? And so much we're so much better. But still, when you survey people, if they suffer from a physical illness, what we find is more than half of them are willing to talk to their employer about it. But when it comes to mental health, we're about at 25%. So you can still see that we're making progress, but we're still not at the place where people feel totally comfortable. So now solutions. As I said, for me, when there's challenges, barriers, there's always a solution waiting to be found. And I think that the market has come up with, great solutions. I'm sure that there are others waiting to be found or waiting to be brought to the market that can help even further. But today I wanted to share with you, I guess, what's accessible right now and what you can use as plan sponsors to help your plan members. So the first one I would say is workplace culture. It needs to come from there. It's the first place. It needs to come from the top as well. Leaders need to make sure that mental health is a priority for the organization. You have plan design. You are offering plan designs. You need to make sure that your plan design has the right services in it. The right. Potentially you might want to look at maximums as well. That can have an impact. What we usually see is that the mental health services are covered with paramedical services, all under an umbrella and with a maximum that covers all of them, which can make that a barrier from a cost perspective. So maybe food for thought there. Virtual care, I think that, we were already on a path to go more towards virtual care, and COVID, the pandemic, has just really accelerated that. And we can see that now people can utilize services and reach their treatment practitioners, on their mobile, online. So I think that, that is a great solution that we have out there to really make sure that, people can, don't have to wait too much, as well. If they don't feel comfortable going out to get the treatment, they can get it online. So I think it is a great solution. And then early intervention. I think we all know, in all disabilities, but, mainly for mental health, you need to really be there at the beginning, and you need to give them all of the resources to make sure that it doesn't become too severe and that people can come back to work very quickly. So now I guess what I want to do is dig into a bit more in all of these solutions to see how you can have an impact. So I'll come back to workplace culture. As I said, it's the number one, and I do think that that's, it's paramount and it's very important. And I think what we want to do there is really get to a place where we've normalized the conversation. People feel comfortable talking about it. They're hearing from it from their leaders. So it just becomes part of the workplace. And what you need to do, I guess, to get there, well, there's leader support. You need to have a strategy and an action plan to make sure that you can focus on that and you can make the right changes. Internal support, as I said, is important. Yes, from the leaders, but then you also need to have that from people managers, from employees, to make sure that you can have that safe environment. And then, you can get to a judgment-free environment where people feel comfortable talking about it. And you can really be there, as I said, at the early intervention and making sure that people that are at risk and at work can access the resources that they need. You've probably heard of the National Standard of Psychological Health and Safety in the Workplace. It is a great resource for those of you that have not heard about that or read that. I think it's a great place to start. It's a set of voluntary guidelines. So really it's up to you as employers to see, to help you find the right tools and support and structure so that you can build that safe environment. People managers, I said, really important. They play a key role, and we won't repeat that often. I think, you can see them as first line responders. They are the ones in contact with your employees. They know them. They know their personalities, their job accountabilities. So they can really help set the tone and identify the people that are at risk. There are a lot of resources, mental health training for people managers. So I really invite you, if you've not done that yet, to look at that for your organization, because it can help people managers identify the risks in the workplace, identify the people at risk. How do you have a conversation on that? How do you build a healthy, mentally healthy environment? So people managers can have a lot of impact, and they can even identify the stigma in the workplace. So I think it is paramount, and it is, they are key in making sure that you have that healthy environment. Your plan, we were talking about access, right? So, as I said, there's already a lot of resources, but sometimes people just don't know where to get it. So really important, again, make sure that people know about the resources that you have. And one thing, and I know that we've done that at Sun Life, is actually tell them, people managers, don't be afraid. Talk about that. Put that as a standing item in your meetings to remind people of the resources that they can have access to. You might have an employee assistance program. That again, right? We know about it because we work in the group insurance space or group benefit space. But for employees out there, sometimes they don't remember that. So make sure, it is that one as well, a first line defense. To help and give support. So we need to make sure that people know that resource is there. And then the plan that you have, you can review that with your advisor, your consultant, make sure that, you review the list of health practitioners that you have, what you feel are the right ones to support your employees. And also looking, as I said, review the maximums that you have, how it's structured, because if you want people to, knowing that cost is a barrier, you want to make sure that they can have the access that they need. We were talking about virtual, so I don't know, you've probably, and we're doing this right now, we would have done it face to face, I'm pretty sure, if it was pre-COVID. So, virtual is here to stay. And I think it's really shown us that, we can really bridge the gap in access to care, either from people that, may be far from the resources. But, there are walk-in clinics that people can have access to. There's online cognitive behavioral therapy. That's a pretty tough one for a French person, so I'll say CBT. So that's a great resource as well that is available. And you also have the virtual independent medical exams. So all of this is brought at the forefront and is, really a great way to help support employees that are in need. And as well, there's a lot of online content that you can bring and give and make available to your employees and people managers to help them manage through that. We did actually 2 pilots, so to dig a bit more into that. So, we did a pilot on CBT, online CBT, and also pharmacogenomics. And on the online CBT, what we did is actually wanting to make sure that we brought it to the people that were on disability. And we saw great results there. We saw 42% reduction in symptoms, but we also saw, because we had another pilot, which was actually bringing it in the healthcare benefit to make sure that at risk, at work employees had access as well. And we saw great improvements as well. So I would really say that, there are resources to support even the at work people. And on the pharmacogenomics, we partnered there with CAMH, and it was really offering that to disabled employees. Again, two things that are great. We saw that the participation rate was really important, so which is an important finding. And also we saw a 20% decrease in the depression symptoms at an 8-week follow-up. So again, showing that, we do have solutions that can help us better manage when someone is on disability. So the key takeaways is really that, there are, yes, barriers. We need to understand them. We all play a very important role in making sure that we bring the right solutions to our workplaces, and that we share them with the employees, that they know when to access them. We don't want them to be on disability to start accessing them. We need to make sure that they're accessible to the people that are at work and potentially at risk, so that we can intervene as fast as we can, and then make sure, that they don't go on disability, and we're able to manage, I guess, the issues that they're having as fast as we can. So thank you very much. It was a great pleasure to be with you this morning. As you can see, this is an important subject that we're passionate about, and I'll turn it over now to Martha, that will manage the Q&A section.
Thank you so much, Sophie. That was amazing. And yes, you're right. We're going to open up the floor for some questions. We actually have one now from Ashley. And she's asking, how can we better support employees in flexibility with mental health services? And she's asking about situations where supports and treatments can be found that are less expensive and faster, but are not eligible necessarily. So she gives the example of getting CBT by an online therapist or a counselor, which wouldn't necessarily be eligible under a psych services plan. And she wants to, and she's emphasizing this idea that she wants to ensure treatment is suitable and up to par, but it needs to be able to fit also in with an employee's life. So what can you say about that?
Yeah, great question. So thank you for that. I would say, there's, definitely discussions probably, I guess, either with your advisor, with your carrier on, if it doesn't fit exactly, is there a way to make sure that becomes available? Other options could be, if you want to make sure that they can access that, if you have a healthcare spending account, that would be available through that. So maybe, it's having that conversation on your plan design again, and making sure, do you have the right items in there to support your employees? And if not, what kind of changes maybe you could make to your plan to make sure that these resources are available and employees can access them. So I hope that is answering your question.
Right. Okay. Perfect. And I wondered if we could dive a little bit deeper into what you were saying about stigma and talking about changing workplace culture. So do you know of any specific things that organizations have done to tackle and challenge that stigma?
Well, I think, so for the first thing I was saying, the people manager training, I think is really important. As I say, they're on the floor, right? They talk to people, and they can be the one that open up those conversations, talk about it, right? So I think that's really, really important. Peer support, we've seen some plan sponsors, employers implement peer support. So again, it's talking about it, but making resources available to employees that are not necessarily management, but people that might have gone through something exactly like they're doing. So that again can help. But I think it's really, it needs to be the conversation. We need to talk about it. And again, as I was saying previously, I think that leadership support, when it comes from the senior leaders and it comes down in an organization, it sets the tone that it's okay to talk about it. It's okay to raise their hands and seek for support when they need it.
Perfect. Okay. And what is the root cause, do you think, of the rise in mental health claims that we're seeing right now?
Well, it's funny because we're talking about stigma. So, I'm not an expert, so, I'm probably not the best person to answer that. What I can tell you is that reduction of stigma can be a cause for the increase we're seeing. So maybe people before weren't comfortable talking about it, and now because they're more and more comfortable, they are wanting to access the resources. So that might be one reason that we're seeing. And there's different things. We're talking about isolation. Technology can isolate people more and more. And we've seen in certain studies that when people feel isolated, it can have a toll on mental health. So those are two things I think that can explain. I'm sure there's a lot of different other factors, just the speed that everything is going on in our society, the expectations of performance, at every stage that you have. So there's a lot of other things, but I think those would be probably top of mind when we talk about that.
Right. Okay. And if we get a little more specific, looking at the millennial generation, we've seen that they have the fastest growing, they're the fastest growing demographic in terms of mental health claims. So what do you think's behind that?
Yeah, that's a very interesting one. And I was, so we have some clients that are universities, and I was talking to them about that. And they were telling me that they were seeing it even in university. They are seeing the students more and more having a need for resources. And I think, again, is it the technology? Is it the pace of change? Is it the isolation that they might feel? So I think the environment in general, but we're seeing it. So all of that, I guess, for the younger generation is having a toll. And then you put on top of that COVID and what all of them, the younger generations have to go through, school was stopped and it all changed their environment. So I think that we really need to pay attention to that because it is very concerning, and we need to make sure that we take care of them. We take care of their mental health, so that they can, continue to grow and have a happy life, and maybe stigma is less as well in that group, right? We saw that they're more willing to talk about it. So maybe that's why as well we're seeing more claims.
Well, thank you so much, Sophie. I have to thank you very much for that wonderful presentation. But unfortunately, we are out of time for questions and are going to have to move to our next one. So thank you again.
My pleasure. Thank you so much, and have a great day, everyone.